Let's discuss what to do if you come upon an individual who has overdosed on opioids. In this scenario, we will demonstrate how to recognize the signs and symptoms of an overdose, administer naloxone nasal spray, and care for the victim during recovery. These are the steps to take in the event of an opioid overdose. If you come across a person who appears unresponsive, try to startle them to wake them up. First, you need to establish consciousness. Generally, someone who is overdosing on opioids is unconscious. If you are not sure if someone is conscious or not, yell in their ear or pinch the trapezius muscle. This is particularly important. If the victim is losing consciousness and you startle them, you may be able to keep them awake and prevent them from going unconscious and stopping breathing. It doesn't always work, but you can try it if the person is slipping away. Call 911 immediately after you determine the person is not responding. Next, examine the vital signs of the victim. First, the victim has shallow or absent breathing. Get your ear next to their nose and mouth and see if you can feel any air movement. Look down the body and see if you can see the chest or the stomach rise and fall. Look, listen, and feel for air. Second, the victim may be foaming at the mouth. Third, the victim will have blue lips and nails from the lack of oxygen. Fourth, the victim will have cold and clammy skin from the inability of the brain to regulate the person's body temperature. Fifth, the victim will have really tiny, constricted pupils. You will likely need to pull their eyelids back to see this. Open the kit and put the gloves on your hands. Tear the foil off the back of the sprayer. If you can position the person on their back and establish a head tilt, like you would for opening an airway, do that first. If the victim is in an awkward position, or it would just take too much time to move them, just apply the spray into the nose where you found them. Put 2 fingers on the top of the sprayer and your thumb on the plunger underneath. Insert the sprayer into the victim's nose until your fingers touch the nose, then push the plunger. The sprays are preloaded, so don't press the plunger before the sprayer is inserted or you will waste the dose. Monitor the victim's vital signs in between the doses. If the victim does not have a pulse and you know CPR, initiate CPR. For performing CPR, a mouth-to-mouth face shield is included in the kit. It is simply a piece of plastic paper with a face painted on it and a foam disc where the mouth is. Position the sheet on the person's face, in the pattern on their face, with the foam disc over their mouth, and breathe in and out through the disc. Some certified CPR courses suggest only performing the compressions with CPR. Remember, the first rule of any first aid responder is not to put yourself in a hazardous environment, and the mouth and face can have hazards, such as blood, mucus, or drugs. Follow your training. If the person is not breathing 2 minutes after the first dose, administer the second dose of naloxone. Once the person is breathing on their own, whether it be after the first or the second spray, but is still unconscious, put them in the recovery position. It is best if the left side is down. The recovery position helps to keep the airway clear in case the victim vomits. If the victim wakes up, verbally encourage them to wait for EMS, as naloxone only lasts 30 to 90 minutes. Whatever substance the person has overdosed on could last up to 16 hours, so the naloxone could wear off and the victim can overdose again on whatever they had previously taken. The naloxone may put the person into withdrawal, especially if they are a regular user of opioids. If this is the case, the person may want to go get another dose of whatever they had already taken, which could compound the overdose problem. So verbally encourage the person to wait for EMS, but do not try to physically restrain the person, as they may be confused, agitated, or even aggressive. Stay at least 2 arms lengths away from the person. The naloxone expiry date in your spray kit is printed on the outside of the foil backing. If all you have available is an expired kit, use it in an emergency anyway. It may have lost some of its potency, but it may still work and it will not harm the person. You can return used or expired naloxone kits to any pharmacy. The pharmacy should also be able to replace an expired or used one for a new one if there is a free naloxone program in your area. Officially, your Narcan spray is to be kept at room temperature between 15 degrees Celsius and 30 degrees Celsius, but you can keep it at temperatures up to 40 degrees Celsius for short periods of time. Do not store naloxone in a hot car in the summer, and do not let it freeze either. Narcan spray freezes at -15 degrees Celsius. For more information, visit administeremergencymedicines.com.